Hey listeners, Dr. Yeager here, and thanks for tuning in to Full Circle Animal Healthcare's weekly podcast. The wonderful warm days of summertime. There's nothing quite like hanging outside with our dogs, enjoying the sunshine. Most of us will make sure to put on some sort of flea and tick prevention on our pets to keep them safe, especially during these warmer months. While many of us humans will use some sort of mosquito repellent for ourselves. Nowadays, there are so many infections brought upon by mosquito bites, both in animal and in people. Today, I'll be focusing on the most common mosquito-borne illness for animals, heartworm disease. I'll be going over what heartworms are and how they develop, how they are transmitted, and why putting your pet on a year-round heartworm preventative is so crucial for their well-being. As a pet owner, chances are that you have heard at least a little bit about heartworms. When you are at an annual checkup or getting your pet's vaccines up to date, your veterinarian will probably stress the importance of testing your dog for heartworms and the importance of keeping your dog and cat on a year-round heartworm preventative. Many folks heed to the advice of their veterinarian, but not many really know what heartworms are or how they are transmitted. Some owners choose not to give their pet heartworm prevention, and some refuse to even test. Sometimes this is to save money on something they truly don't realize the importance of. And sometimes it is out of fear that they will be over-medicating their pet. Let's talk facts on the often fatal, all too common, and nearly 100% preventable disease that claims the lives of so many animals every year. Heartworm disease, transmitted through the bite of an infected mosquito, is a serious disease that can often be fatal. The disease can be found all over the United States as well as much of the world. In the adult stage, these worms can grow to be about 12 inches long. They take over the heart, lungs, and blood vessels of the infected animal. Picture spaghetti-like worms wiggling their way through your pet's arteries. Not a pleasant thought, is it? These nasty parasites can cause a whole host of health problems, including lung disease, heart failure, cardiovascular damage and collapse, severe damage to many of the body's organs, and when left untreated, these heartworms can cause death. Even early on, they affect the general quality of life of an infected animal. Although clinical symptoms early on can be few or even seemingly non-existent, with time the infected may often develop some symptoms including a persistent, mild cough, lack of appetite, and fatigue after even a small amount of exertion. Heartworms infestations claims a variety of wild mammals, including wolves, coyotes, foxes, as well as our companion dogs, cats, and even ferrets. Dogs are a natural host for heartworms, meaning that once a dog is infected, the heartworms are able to mature and reproduce at alarming amounts of offspring. Treatment for dogs who have been diagnosed as heartworm positive is available. It can be a painful and very expensive process that does not always ensure that the dog will survive. Many dogs who are not exhibiting symptoms or are only exhibiting a few tend to have a high success rate for the treatment. Dogs who are exhibiting more symptoms and dogs who have a more severe case of heartworms are much more likely to run into complications during the treatment. Keeping your dog on monthly preventative is absolutely the best, easiest, and most affordable solution to this awful disease. For our feline friends, the disease is quite different because the worms are usually not able to reach adult stage. However, even in an immature state, heartworms can cause serious and lasting damage. The most common being heartworm-associated respiratory disease. There is no drug therapy treatment for diagnosed cats, but with the care of a good veterinarian, infected cats can be helped. Just like dogs, monthly preventative for heartworm is the best solution to keep them safe. How do these deadly worms enter your pet's bloodstream in the first place? The American Heartworm Society explains that the mosquito plays an essential role in the heartworm life cycle. Adult female heartworms living in an infected dog, fox, coyote, or wolf produce microscopic baby worms called microfilaria that circulate throughout the bloodstream. When a mosquito bites and takes a blood meal from an infected animal, it picks up these baby worms, which develop and mature into infective stage larvae over a period of 14 days. Then, when the infected mosquito bites another dog, cat, or susceptible wild animal, the infected larvae are deposited onto the surface of the animal's skin and enter the new host through the mosquito's bite wound. Once inside a new host, it takes approximately 6 months for the larva to mature into adult heartworms. Once mature, heartworms can live for 5 to 7 years in a dog, and up to 2 to 3 years in cats. Because of the longevity of these worms, each mosquito season can lead to an increasing number of worms in an infected pet. So, the more animals that have heartworm disease in an area, the more at risk that area becomes. Over the years, the number of dogs who are diagnosed as heartworm positive has been steadily growing. This is one cycle that needs to be broken, and the only effective way to do that is to keep your dog or cat on heartworm preventative throughout the year. Even if you have a young puppy or kitten, now is the time to talk to your veterinarian about what you can start them on as far as heart preventative goes. What about testing? Heartworm testing in dogs must be done once a year for dogs over 7 months of age. The American Veterinary Medical Association suggests that dogs should begin getting tested for heartworms at 6 months of age, as it takes about 6 months for heartworms to develop into adulthood. Adult heartworms are what the tests are able to detect. Your heartworm test acts as your yearly prescription to purchase a year's worth of preventative. Even if you are diligent in giving your dog heartworm prevention every month of the year, the test must still be performed annually, as there is a chance, although it is a small chance, that there can be a breakthrough. For cats, testing for heartworms is not as simple as a blood test. Because heartworms do not usually fully develop in a female host, they are not able to be detected in a blood test. Screening a cat for heartworms usually includes an antigen and an antibody test. Some veterinarians will perform x-rays or ultrasounds as well. The American Veterinary Medical Association, American Animal Hospital Association, American Heartworm Society, as well as the majority of most veterinarians in the United States, stress the importance of keeping your pet on prevention year-round, not just during the warmer summer months. It only takes one infected mosquito bite to give your pet heartworm disease. For those who are worried that they are over-medicating their pet, know that the heartworm prevention products that are on the market have gone through a series of testing to make sure that they are safe to give to your pet. There are several key drugs that combat heartworms, and some have proven to be more palatable than others. Products that contain milbemycin, for example, have proven to be over 99% palatable and safe for all breeds of dogs. it is important to discuss which prevention would be the best for your pet. Every year, only a handful of dogs suffer from reactions, especially serious reactions, to being on the preventative. Missing 1 month of prevention can greatly increase your pet's risk of contracting heartworms. Many companies will back their product if you purchase 12 doses at a time. It's a win-win situation. Your pet stays protected for the whole year, and in a sense, you have insurance and peace of mind in case there is a breakthrough. Talk to your vet about the best preventative medicine for your dog and ask about which companies back their products. As awful as heartworm disease is, remember that it is nearly 100% preventable. It's as easy as giving your pet one preventative chew, pill, or applying a topical solution each month. If your dog or cat is not currently on heartworm prevention, I urge you to take them to your veterinarian to get them tested and started on prevention. Your pets will thank you. From all of us here at Full Circle Animal Healthcare, we hope your furry family members have a wonderful, safe, and happy summer.